So for a higher stimulation, you're going to want to probably go with some type of strumming pattern. With jazz, you still want to try and keep that syncopation. That also adds another layer of complexity to it. Timbre, you want to use your nails so it'll be more bright. You have that more of an attack. And the dynamic wanting to be mezzo forte to forte, kind of. Also, something I think is good to know, if you're like using it for an ISO, sometimes patients just, they really don't like the really harsh and bright timbre. So sometimes you might have to like figure out which modality of stimulation works best for that specific patient. Like there's one, like for example, if somebody, they really dislike the timbre, you're mainly going to want to make sure that your tempo and your volume and your accompaniment pattern are going to be the main ways that you're going to match their intensity and their presentation, and then decrease those things over time to kind of reduce stimulation and produce whatever effect you're going for, whether it's reduction of agitation or pain awareness or whatnot. But here's a good example of a high stimulation song. Every honeybee fills with jealousy when they see you out with me. I don't blame them, goodness knows. The honeysuckle rose. When we're passing by, the flowers weep inside, and I know the reason why. I don't blame them, goodness knows. The honeysuckle rose. Well, I don't buy sugar. You just have to touch my cup. You're my sugar. It's sweet when you stir it up. When I'm taking sips of your tasty lips, and I